everyone, my name's Emma. I am a CAMHS mental health nurse and I'm the children's clinical lead for Wysa. So I could spend ages talking to you about the increase in demand in mental health, but you all know that because you work in mental health. And equally, all of my previous speakers today have spoken about that. However, today, in fact, we're launching our newest report, which is this. You can come and pick up a copy from us and we would love to give them all out. This report was created by 1,400 young people. And we went to them and we asked them about their experience of digital and mental health, not of Wysa particularly, but specifically what they thought about mental health. Because as all of the speakers today have spoken about, understanding where young people are at so that we can meet them there is really important. Part of the report, we found that 49% of young people worry most about their mental health before they go to school. So that's from 6 to half 8 in the morning is when the amount of worry was highest, when unfortunately a lot of our services aren't open. We also found that 1 in 3 of young people who responded reported symptoms of anxiety and depression. That raised to 2 in 5 for 16 and 17-year-olds. From that, of those young people who scored clinically as worrying about anxiety and depression, 55% said they hadn't reached out for support, and this was because they were embarrassed or they thought that nobody would care. Of them, 33% turned to TikTok. Pains me, that knowledge, but it's important to know because if they turn to TikTok, when I first got interested in digital, it was because young people were turning to Google and we were doing co-design workshops. And a young person came into the workshop and said, did you know if you Google a safe alternative to cutting yourself, the third option says to burn yourself with an aerosol? And we left the workshop and it was 100% true. And now they're turning to TikTok, which is even harder to review all of the content on. So it's important to know that's where they're looking. We also found that 60% of young people would prefer to speak to an app than a doctor. So what is the project that we're really here to speak to you about today? So we did a project recently with Hammersmith, Fulham and Ealing and Hounslow Mind. So they were looking for an innovative way to scale support to young people in a way that they would really engage with. They were recognising this idea that young people would rather speak to an app in the first instance than necessarily speak to a teacher or a doctor or a clinician. And how could they utilise that to ensure that young people had 24/7 accessible support early in their kind of pathway, but that could also safely signpost them into services if that's what they needed. Wysa is an AI-enabled chatbot. I wasn't going to talk much about that, but several people have asked me today if we're from ChatGPT. We're not. I can assure you. So Wysa is an AI-enabled chatbot. It's clinically designed. So when you are chatting with Wysa, it will ask you to reflect on your day, on your experiences, and will recommend a number of clinically designed tools that might be able to support you with what's happening at the moment. That includes things like relationships, anxiety, sleep, students, exam stress, etc. We also collect outcome measures, as my colleague spoke to earlier. They're quite lengthy. Don't know what it is with us in the UK and giving young people long tests, but apparently we do it in mental health services as well. So we can support collecting outcome measures. And what HFEH wanted to do was see if there was a way we could do all of that that supported a pathway for a young person from beginning to end and made it easier for clinicians to utilise that data in a productive way. So we created an integration with iAptus that means when a young person is using the app, the tools they use, the resources they use, the type of use they're doing, pushes into iAptus along with the outcome measures. You can see that in their progress notes. So you as a clinician can go on and see, were they engaged between sessions this week? Were they using resources? Why they were on the wait list? Were they doing some self-help stuff? Were they working on things that can be supportive? It also means that we can signpost the SOS. So a couple of the questions we've already had today is how does AI handle SOS? So our particular AI, if you are using free text that's indicative of self-harm, suicidal ideation or abuse, it will signpost you to the various helplines that your local service have had customised, and it will also push that information into iAptus to let your local clinician know that you've triggered the SOS pathway. So this is what we built for Hammersmith, Fulham and Ealing and Hounslow Mind. My colleague Anya couldn't be here today, so she has done a video to explain what it's meant to the service. This may or may not play.
At HFEH Mind, we believe it's really important that we start introducing digital apps such as Wysa into our care pathways because it can improve care and outcomes in a number of ways. So in terms of our service, we have three main pathways in which we use Wysa. Number one, we give access to Wysa on its own. So this is for young people who show a very low level need when it comes to mental health. And in this sense, we would be using it as an early prevention tool, helping young people improve their general knowledge and skill when it comes to managing and taking care of their own mental health and well-being. We also usually give young people a sort of allocated practitioner, like Wysa practitioner. For the first 8 to 10 weeks, you can just check in with them, make sure they're using the app okay, and then we would let them use the app on their own for the remainder of that year. Another pathway in our service is using Wysa alongside clinical intervention. So it's really useful to use Wysa for things like homework setting. So for example, if a young person mentions in a session that they're really struggling with their sleep and sleep hygiene, a homework task might look like doing the Wysa sleep module and planning a nighttime routine on the app. It's really then easy for practitioners to monitor how the young people are getting on with that homework task, as we can look at that progress on our clinical record keeping system, which makes it really simple to just make sure everything's getting done. Finally, we also give Wysa access to those who have completed their intervention successfully. So, for instance, we use Wysa in our brand new Children and Young People's Crisis Cafe, The Circle, once their sessions have ended. And this is a really useful way of promoting continuation of care and support and ensuring that young people aren't feeling like they're being left alone once discharged from the service.
So the priority pathways that Mind wanted to target and that we can now kind of expand our work in is initially starting at the preventative population support. So this was providing Wysa to everybody, saying actually AI is really low cost and easy to scale. We can scale an anonymous version of it so that all young people who are not yet open to CAMHS can download it, have access to evidence-based support and clear and concise signposting if they need further support. It allowed us to increase access in areas like MHSTs and community support initiatives, particularly in areas where we found from our young person study that 78% of young people would rather talk to an app than a teacher. And when teachers were the gatekeepers to the MHST, this meant they weren't seeing the uptake they were hoping to. Integrating an app that could then signpost the young person to the MHST if they were of clinical need meant they could increase that access. We then focused on the waitlist support. So once triaged and accepted into the services, young people were facing long waiting lists. Wysa was provided as a waitlist support so that they could access all of those tools and resources and SOS signposting. And that integration with IAPTUS meant that clinicians could know through the flow of data what a young person was up to, what tools they were using, and importantly, what their outcome measures were saying, and any SOS events. We found that this could also have the potential to reduce unnecessary A&E admissions. This was a service that was particularly seeing a high number of A&E admissions in the evening, so between 9:30 at night and midnight, when traditionally services aren't open, and young people attending A&E hadn't actually actively self-harmed, but were being given the advice that the only place you can go to out of hours is A&E. And when they were looking on 111, that's what they were being told. So by allowing them access to an app that gave them alternative routes of access, we were looking to reduce the access into A&E. And then finally, as Anya said, looking at discharge support. So when a young person downloads Wysa, they get access to it for up to 12 months. And that means that they can continue to practice the tools that we teach in therapy and can continue to use them. And if they forget about them, Wysa's got push notifications, so it'll pop up on your phone and say, have you done this piece of practice that we know is really helpful? We've spoken about the additional benefits, and I know I'm standing between you and your lunch, so we'll quickly skip through that one. So what does the future mean for AI in mental health technology? AI will never replace therapists. It shouldn't. That's not what it should do. But it can help to augment the care pathway so that young people can access support far earlier, that it can continue to follow them. And an app like Wysa, we have 5 million users across the world. We can follow young people into adulthood, follow young people into older adulthood if they want to. So it means that people get a continuous source of support. Our next area of development is going to be building on a project that we've recently started in Scotland. So Wysa has received research funding to support the young people of Scotland as an early intervention and prevention. And we'll be working with IAPTUS to build on that data so that when young people are using the anonymous preventative version of Wysa, If the data indicates that they require a referral to services such as CAMS, that referral data can be pulled into a nice seamless e-triage package and pushed through to the CAMS service, so they've got the voice of the young person in the referral rather than a referral that's predominantly filled out by parents. And we'll be doing that this year and seeing if we can make it more seamless. So that's the end of mine. Sorry, I rattled through that because I was told you needed time.
Thank you very much, Anna. Thank you.